Alright, y'all, so I'm actually on the way to the gym. Canceled my midday class for today because the rain is no mixture, you know. I don't think it's that bad, but I'm not gonna risk nobody else's life, right? But a conversation actually came back to mind yesterday in class. I was talking to my students, you know, we were having an open conversation, and one of my students was talking about how her mom had a kidney transplant, right? And just how, you know, that process was, and, you know, because we go around, I have to introduce themselves and why they took the class, you know, things like that. And she was just talking about how, you know, she wants to gain more knowledge and be able to help her mom because she takes care of her mom. Well, my cousin, I have a little cousin, shout out to her. She needs a kidney transplant because whenever she was pregnant with her second daughter, like, the hypertension fucked up her kidneys, right? And my student, her mom was a diabetic. Diabetes can fuck up your kidneys. Kidneys, hell, pancreas ain't acting right, whatever. But the point being, the kidneys are so very important. The kidneys and the liver. Honestly, damn near all of the fucking body functions are important for various reasons. But them damn kidneys, baby, you need your kidneys. I don't care if, okay, yeah, it's some people functioning with one, but you need your motherfucking kidneys because they filter, right? So I was telling her how so many different medications can fuck up your kidneys. If not your kidneys, your liver. You know, because then we got on the subject of Tylenol. You know, like, there is a max amount of Tylenol that you're supposed to be taking in a day. And then piggybacking also when we're talking about PRN orders. PRN orders are for medications you need as needed for whatever that reason is, right? And people, that's why I was pretty much telling them that with a PRN order, you have to have a frequency. Like, if not, think about it like this: if you don't have no frequency for a medication, motherfuckers just gonna be at the damn house. Why is this truck riding beside me like this? Damn, just go ahead. Why, if people will take some medicine however they choose to take medicine at home, if you don't give them no directions, granted they still gonna do what they want to do, but you should have a frequency. How often can they take this medicine? How can they take it every 2 hours? Can they take it every 4, 6, 8, 12, whatever it is, you need to have a frequency. But it's been plenty of times, actually I feel one too many times, where I'm at the hospital working and I've had patients who end up on dialysis because we fucked around and shot their fucking kidneys. Like, I think that is, like, that is fucking flabbergasting. Honestly, I really feel like it's malpractice, because how are we not paying enough attention to where we fucking up these people's kidneys? I'm telling y'all, I done had about 3 patients like that, and it was one hospital in particular I had all them motherfucking patients at. Cool, you want to diurese them, that's fine, then motherfucking dandy, but you need to be paying attention to that fucking lab work where you not shot in they fucking kidneys. Shot, whatever. You need to be paying attention to them kidney functions. I'm telling y'all, I don't really believe a lot of people understand, like, y'all, you get one body. Like, you have to take care of this one body. Especially when people are living longer now. And it take, because then I asked her, I was like, well, how long did it take for your mom to get a kidney? She was like, about, I think she said 9 years. She was originally on the list at one hospital for like 6 years, and then she ended up like having to start a process over or something like that. I don't know why. But then it was like another, I think she said 3 years, 9 or 10 years. I can't remember if she said 6 or 7 years. But pretty much it was a long time. Like, all right, cool, because like my cousin, she been waiting for quite a few years to get a kidney too. But even that whole process, man, like, I don't know, healthcare is something, honey, because even for them people to get the kidney, depending on what insurance you have and stuff like that, you still gotta come out of pocket for some of that cost, like, to actually give the fucking, or get the kidney and have it you know, have it transplanted, and then the medical costs for that. But then on top of that, you gotta hope your body not gonna reject that damn kidney. Baby, when I tell you, the fact that our health is so important and it's so commercialized and profitable is actually quite sad. Quite sad. And this is why we say prevention is so much better than cure.